In the moments after an accident, what happens next can change everything. An ordinary day can turn into an extraordinary one in a single heartbeat. Someone falls, someone chokes, someone gets hurt. It is in these critical minutes, before the paramedics arrive, that simple actions can have a profound impact. This is where you come in. First aid is not some complex medical science reserved only for doctors and nurses. It is a set of straightforward skills that anyone can learn. Knowing what to do can turn fear and panic into calm, focused action. It is about having the confidence to step forward when others might step back. The truth is, most emergencies don't happen in a hospital. They happen at home, in the park, at the office, on the side of the road. The first person on the scene is rarely a medical professional. It's a family member, a colleague, a passerby. That person could be you. Having basic first aid knowledge empowers you to be that crucial first link in the chain of survival. It can prevent a minor injury from becoming a major one. More importantly, it can sustain a life until professional medical help takes over. Think of it as a bridge, a vital connection between the incident and the hospital. Imagine the feeling of knowing exactly how to help a loved one who has cut themselves badly in the kitchen. Picture yourself calmly assisting a stranger who has fainted in a crowded shop. This isn't about being a hero, it's about being prepared. It is about being a capable and reassuring presence in a moment of chaos. Before you rush in to help someone, you must take a moment to stop and think. Your safety is the absolute priority. You cannot help anyone if you become injured yourself. The very first step in any emergency is to check the scene for danger. Look around you. Are there any hazards? Traffic on the road, a fire, fallen power lines, an aggressive person nearby? Assess the situation from a safe distance first. This quick check protects you, the person you are about to help, and any other bystanders. Making the scene safe is your first and most important job. Once you have determined that the area is safe to approach, your next step is to figure out what happened. Try to understand the situation. How many people are hurt? What is the nature of their injury or illness? Look for clues. Is the person conscious? Are they bleeding? Do they seem to be in pain? This initial assessment helps you decide on the best course of action. It also gives you vital information to pass on to the emergency services. Now it is time to get professional help on the way. Calling for an ambulance is a critical step. In the UK, you dial 999 or 112. When you make the call, be prepared to give clear and precise information. Tell the operator your exact location. Be as specific as possible. Do not hang up until the operator tells you to. They may give you instructions over the phone. Following the operator's instructions is incredibly important. Cuts and scrapes are among the most common injuries we face. While most are minor, some can involve significant bleeding. The first step is always to apply pressure. Find a clean cloth, a sterile dressing from a first aid kit, or a piece of clothing. Place it directly over the wound. Press down firmly with your hand. This helps the blood to clot and slows bleeding. If you can, wear protective gloves to prevent infection. Keep applying steady pressure. Do not peek underneath to check. If bleeding is severe or doesn't stop after a few minutes, elevate the wound. If the cut is on an arm, raise it above heart level. If the cut is on a leg, raise it above heart level. Continue direct pressure while the limb is elevated. Keep the person calm and still while you wait for help. Burns are another common household injury, often caused by hot liquids, hot surfaces, or steam. The immediate priority is to cool the burn quickly. Use cool running water. Place the burned area under a gentle stream for at least 20 minutes. Cooling stops the burning and prevents deeper damage. Cooling also provides pain relief. Do not use ice, iced water, or creams and ointments. After 20 minutes of cooling, cover the burn with cling film in layers, not tight. Choking is a terrifying experience, but knowing what to do can save a life. It happens when someone's airway gets blocked and they cannot breathe properly. If you see someone coughing forcefully, encourage them to keep coughing. This is often the most effective way to clear the blockage. However, if they are unable to cough, speak, or breathe, you must act immediately. Give up to 5 sharp blows between their shoulder blades. Use the heel of your hand. Lean them forward slightly to help the object come out of their mouth rather than going further down. If the back blows do not work, you need to perform abdominal thrusts, also known as the Heimlich maneuver. Stand behind the person and wrap your arms around their waist. Make a fist with one hand and place it just above their belly button. Grasp your fist with your other hand. Then pull sharply inwards and upwards. Perform up to 5 of these abdominal thrusts. The motion is designed to create a strong upward rush of air from the lungs which can dislodge the object. Continue to alternate between 5 back blows and 5 abdominal thrusts until the object comes out or help arrives. Fainting is another common medical event where someone briefly loses consciousness. It happens when there is a temporary drop in blood flow to the brain. Someone who is about to faint might look pale, feel dizzy, or start sweating. If you notice these signs, help them to lie down on the floor immediately. If possible, raise their legs slightly, perhaps by resting them on a bag or a coat. If they have already fainted, check to make sure they are still breathing before gently rolling them into the recovery position. This simple posture protects their airway while they regain consciousness, which usually happens within a minute or two.